A hearty good afternoon to everyone, and welcome to a session on women's health after 35. And we are glad to have Dr. Prema Jayaprasad among us to help us understand the topic. Age is just indeed a number, but our body experiences a lot of changes as the years pass. So, Dr. Prema will explain the importance of good health, especially after the age of 35. So, Doctor, you have the stage.
Thank you. This is a topic where I want to discuss health after 35. What is health? Health is free from diseases. But what is wellness? Free from health, body and mental diseases is what I want to stress. Okay. What are the issues currently faced by people after 35? Uh, Now women are more career oriented, so they're settling in fertility or reproductive function start very late. Earlier, 10 to 20 years before, the reproductive age group was between 20 to 30. But now, because of the career, they put career in front of their family life. So they start the career only after 35. So what happens is the risk factors involve age related risk factors because of the stress they undergo lifestyle modifications because of work. They have a lot of stress, deadlines, and work pressure, so they neglect the body and health. So what happens is they land up with predisposing factors, history of family history of diabetes, hypertension, hypothyroid, all come into play when they get into the fertility part. So fertility among the general population in the reproductive age group, about 10% of the people have this PCOS, hormonal imbalance, even before they start the reproductive functions. So especially family. So it is better as a preventive measure to have a pre-marital counseling or a pre-conceptional counseling just to find out the basic details about the woman. So women have to be aware that there are certain diseases which can be found out even during a proper counseling. And if there is a family history of genetic disorders, chromosomal abnormalities, then it is better they go for a counseling and a proper checkup with gynecologist. Moving on from the PCOS, we will go into the next topic that will be like infertility, which is also very common. Infertility is for both male. Sorry. Coming on to the for male factors and female factors in infertility, the evaluation of both the couples is necessary. And moving on from the infertility part, it is the high risk pregnancies involved. High risk pregnancies can be because of the age factor, age related problems like diabetes, hypertension, thyroid, and obesity all play a factor in the role of pregnancy. During pregnancy, they land up in high risk category. So these also can be prevented by taking precautions prior to conception. So from there we move on to uh, menopause. Menopause is an event where cessation of periods takes place, and during this time, they have a lot of hormonal changes, and stress also plays an important role in 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 menopause during menopause time, and people land up in menopause wherein there are so many complications along with the body changes. Even the mental health has to be taken care of with proper counseling during that time. Menopausal changes can be supported by hormonal, non-hormonal therapies along with physiotherapy and other requirements. Then there is an important symptom which is never spoken about is the vaginal discharges, and vaginal discharges due to bacterial, fungal, and viral infections, which is very common in the sexually active group. And following a delivery, especially an instrumental delivery or vacuum delivery, a natural birth, which was little difficult, can lead to loosening of the vagina, and hence little bladder, urinary leaks, bladder descending down, and the motion bag bulging, and difficulty while having passing motion, or difficulty while coughing and straining. They do have this urinary leaks, and these urinary leaks, these symptoms are never even spoken about. Usually they confine to the close friends, peer group, or mother. But usually they tell that this is very common, and they never visit a clinician to gather more information about this. And there are easy treatments, like you can have exercises, you can have energy based device treatments, then non surgical, surgical treatments, and complete cure. All of them are possible. But then a visit to the clinician is what is important to identify whether it is a serious problem, or it is a problem which can be handled with simple solutions. Coming to the preventive aspects of this thing. So, how do you go about all these various issues which have I have spoken so far? So now we will go taking one issue after another by looking into the preventive aspects. So, anybody after the age of 35, what are the general preventive things we can do? What are the diseases which can be prevented and completely cured among women? First one is cervical cancer, second is breast cancer. So, how to prevent these two? Cervical cancer is a slow growing cancer, and this usually happens because of the human papilloma virus infection. So, generally, every woman who is sexually active after the age of 20 can go in for yearly screening. Yearly screening once in a year for pap smear. And cancer can be detected early. If detected early, it is completely curable. Then, coming to the breast cancer. Breast cancer is uh, it is also preventable if it is detected. It can be preventable by two things: one, self examination of breast, and annual checkup with the clinician, and third thing is mammogram. So, anybody after the age of 30 should be taught about self examination of breast, and this can be even taught in the schools right from the age of 20, and this can be continued till the age of 40. After that, it is annual mammograms and clinician visits to detect small lumps, and thereon to uh, take the proper corrective preventive steps. History of genetic family history of breast cancer and genetic predisposition like late marriages, uh, no children or late childbirth. All these and family history of breast cancer are all risk factors. Keeping these risk factors in mind, uh, you young women who are above 35 should take initiative to visit the clinician and have a annual checkup. Then moving on to the next disease, common diseases, heart disease, especially coronary heart disease. This is about 25% of women after the age of 40 to 60 land up with coronary heart diseases. The heart disease is very common because of the high cholesterol levels, high blood pressure, and high lifestyle modification wherein they start living a very sedentary life and obesity. These are the factors which lead, these are the risk factors which lead to this condition. So, an annual checkup uh, with blood pressure, cholesterol, and ECG is mandatory to prevent this. Like moving on from the heart disease, next is osteoporosis. Very common that after the age of 35, the bones start undergoing the osteoporotic changes. So, what happens is because of the hormonal changes also in women, osteoporosis sets in, and calcium deficiency, vitamin D deficiency increases, plus the lifestyle. A lifestyle changes wherein exposure to sunlight is very minimal, and people mm, don't expose themselves to sunlight and stop exercising, and obesity. All these are risk factors for osteoporosis. So the bones start getting weakened post menopause, that is after the age of 50, it increases drastically, and that is a reason for weak bones and lot of fractures. So to prevent this, it is better to have an annual checkup after menopause with uh, I mean, check your bone density along with your vitamin D and calcium levels. And moving on, mental health, depression. All this is very common after menopause, not only because of the hormonal changes. It is that a woman feels very depressed and uh, separated from the family, and uh, they do not cope up with this menopause symptoms. Many people are not willing to talk about this because they think talking about mental health is still a taboo, and awareness is very, very less. The changes what they undergo can cause them into mood swings, petty quarrels with the spouse, and uh, quarrel with the children, and mood swings, which will not be recognized by the family also. So it is high time when a woman undergo these menopausal changes that awareness is spread among the family members also. This is very much normal, and advise them for a counseling wherein the woman gets better with just counseling sessions and maybe little bit of hormonal or a supplemental therapy which will help her uh, cope up with the mental disease also. Last but not the least, what are the immunization available after just before pregnancy or just before, immediately after marriage, when people want to know what are the vaccines that is to be taken. all this also counseling can be done, and the vaccines which we normally do give in pregnancies are we give tetanus toxoid, TB vaccine, and then vaccines for pneumococcus, new vaccine for meningococcal, and vaccine for chicken pox. And now among COVID, even COVID is taken when couples are planning for pregnancy. Then moving on, uh, what is that you will do after the age of 35 is that self-care is very important, and so health is very important. So annual checkup is compulsory, or it is mandatory, like how we start taking health plans. It is better you also visit the clinician, discuss the problems, what is faced, and especially the family history, the predisposing factors, the risk factors which is there, and the risk factors which is seen during the pregnancy or post pregnancy, and then uh, the weight changes. So I request an annual checkup which will include height, weight, blood pressure check, your sugar checks, then annual cholesterol check, along with that pap smear, mammogram. These are basic things which can prevent all the diseases which I just I mean, just now we spoke about. So at least the basic six diseases that includes the cancer, the cardiac diseases, the uh, osteoporosis, and uh, finally uh, the lifestyle modifications. Along with this, obesity is another factor which has to be considered. Obesity, wherein you definitely have to take care of your weight and do the lifestyle modification and diet modification. Diet modification is eat which is very colorful, minimal time, minimal quantity, but frequent meals so that your weight doesn't add. Um, Finally, the take home message is above 40, it is better you meet your clinician on a regular basis and have your uh, I mean, have your checks done annually so that you can prevent all the preventable diseases. Thank you. No questions asked. It's okay. No question. No question. Just type yes. No.